As I mentioned, I will be on my presentation today. I will be talking about the common injuries that swimmers suffer from. And as I also mentioned, I swim here for UK, and I thought it might be interesting as my introduction to show you guys our intro video from last year, just so you guys can see a little bit of swimming and diving. So I'll go ahead and click on that. But I do apologize for the advertisement before our video, but I hope you guys enjoy it.
In the outback, there's just one good thing after another. So come on in and enjoy 4 mouth-watering courses with our limited-time Outback 4 menu. Get a delicious soup, salad, and your choice of entrees like our signature sirloin, wood-fired grilled shrimp, or juicy pork tenderloin, plus our rich and creamy cheesecake. That's 4 amazing courses for only $15. It's all yours, mate, so go for it. It's always fresh in the Outback.
So I hope you guys enjoyed that, and once again, I'm very sorry for the advertisement. But I'll go ahead and start talking about common injuries that swimmers suffer from. And so the 3 really common areas of injuries for swimmers are the shoulder, the knee, and the back, more specifically the lower back. So I'll go ahead and start talking about the impingement syndrome, which is a type of shoulder injury. So what is it? It's caused by the inflammation of the tendons surrounding the rotator cuff in your shoulder. And the rotator cuff is made up of 4 principal muscles and is responsible for supporting and creating movements, and especially those repeated movements in swimming. And one of the rotator cuff tendons becomes pinched when the bones, between the bones, which form the shoulder joint when you have impingement syndrome. And one main cause of impingement syndrome is rotator cuff tendonitis. And this is inflation of the tendons, which creates less room for the tendons to travel through the subacromial space and can be very painful. So why do swimmers often have this impingement syndrome? So the constant shoulder movements that swimmers make throughout their hour, 2 hour, 3 hour long practices, it gradually causes the tendons to rub against the underside of the acromion, which can cause pain and irritation. Poor technique of stroke mechanics can reinforce movements that are too stressful on the shoulder. So if you have bad technique and you're rubbing those tendons against the underside of the acromion over and over and over, then you're just reinforcing that, and it's going to be more painful and become more irritated. And swimmers tend to have strong muscles in the front of their chest, the front of their shoulders, but the back side of their shoulders are not as strong. So this can cause the shoulder to be forward rounded, and when that happens, it decreases the space that's available at the shoulder joint, causing one or more tendons to be trapped when the arm is raised. And as you guys saw in the video, we raise our arms a lot. Every stroke we take, we're raising our arms. And it's a common overuse injury. So treatment for it, you stretch before and after exercise. You want to stretch those tight chest muscles in the front of your shoulders, make them more flexible so that your tendons will have more room. And I included a link here that I think had very good examples of good stretches for your shoulder if you have impingement syndrome. I'll just go through these real quick. And these are all stretches that we usually perform before we're getting in the water, but if you really have bad shoulders, you should probably, or well, you should perform these stretches before exercising and after exercising. Another form of treatment is strengthen your rotator cuff muscles. Pain medications for the inflammation and just for the pain that you're feeling. But if you have impingement syndrome, you should discontinue activities that cause shoulder pain because all you're going to do is make it worse. And correction of stroke mechanics. If your stroke mechanics are not very good and you're just reinforcing them every time you practice, so you need to correct those before you make it even worse. I also have a YouTube video here of impingement treatment that has a lot of the exercises that I've seen people in the training room and on my swim team perform, and they're just good exercises for impingement syndrome.
Strengthening for this condition should focus on stabilizing the shoulder by strengthening the rotator cuff muscles and the scapular stabilizer muscles such as the lower trapezius and serratus anterior. The rotator cuff muscles can be strengthened by rotating the shoulder both internally and externally as shown. Start with a very light weight and do not perform these exercises if they are painful. To work on the scapular stabilizers, shoulder retraction is very useful. With the weight in one hand, pull the shoulder blade upwards and towards the spine, hold for a few seconds, lower and then repeat. A dumbbell pullover exercise works the serratus anterior and latissimus dorsi muscles. The weight is held in both hands and lowered over the head. Provided these exercises are pain-free, more challenging exercises such as shoulder abduction, also known as a lateral raise, and shoulder presses can be performed. Posture should always be considered when performing shoulder and back exercises, ensuring that the shoulder blades are pulled in and back.
Okay, so those are very good exercises to perform if you have impingement syndrome, and as he said, as those exercises get easier and you're pain-free with them, you can move on to harder exercises that can help prevent you from getting the impingement syndrome again. I've also included another YouTube video here that I would like you guys to watch because I think this guy does a really good job of explaining just an overall conclusion of what I've just talked to you about, including impingement syndrome and specifically geared towards swimmers.
The most common problem in swimmers tends to be something which we call swimmer shoulder, and this is especially for people who do a lot of freestyle and butterfly swimming. In swimming, about 90% of your power, your propulsion power, is generated from your shoulders, and that's why they're under a lot of stress. Now, there are two phases of the swimming stroke, basically what we call propulsion and recovery. Propulsion requires that you need a very stable shoulder in order to generate the power, right? The shoulder acts as a fulcrum here. In recovery, you need a very flexible shoulder in order to complete your stroke. So these two are actually at odds, right? So unfortunately, if you develop too much flexibility, which a lot of swimmers have, they get very nice recovery, but in the propulsion phase, they end up with problems because the rotator cuff, which is trying to stabilize the shoulder, gets under too much loading. So that's actually the basis of swimmer shoulder, that the rotator cuff gets a bit overloaded, and usually in the propulsion phase. Now, what do you do about this? Number one, strengthen up your rotator cuffs. All right, there's some rotator cuff exercises which you can do, which physiotherapists can teach you, or you can just learn them and do using a TheraBand. The second thing, and probably very important, is to look at your stroke, and you might need to do this with your coach because the primary thing in preventing rotator cuff injuries with regards to your stroke is to make sure that you have enough body roll, right? So when you're doing your stroke, you should not be flat in the water. You should be rolling, right? And the body roll will help ensure that the rotator cuff does not get impinged as much, both during the propulsion and the recovery phase of swimming.
As I said, I think that is a very good conclusion and overall a good source of information for what impingement is and why swimmers get it and how it can be corrected. So the next area I'm going to focus on is the knees. And you can get knee injuries whether, no matter what stroke specialty you have, but I'm going to focus on breaststroke knee because breaststroke is probably the stroke that puts the most pressure on your knees. And I've included a picture here so that you can see where the force is going on in the inner side of the knee. But I've also included right here a very short clip since a lot of you aren't swimmers, so that you could see what breaststroke kick is and hopefully be able to apply what I'm getting ready to tell you and see how you could get knee problems from this type of kick.
If you're going to learn a great breaststroke kick, why not go to the best? Rock Santos, 200 breaststroke U.S. Olympian and multiple Masters world record holder, shows us a couple tricks to an effective kick. Why do it? Narrowing your kick limits the resistance during the recovery of your kick. Less resistance means you'll hang on to more momentum during the typical dead spots in breaststroke.
I'm going to stop the video right there because I just want you guys to get a general idea of what breaststroke kick looks like. So what is swimmer's knee or breaststroke knee? It's most common in swimmers who swim a lot of breaststroke, as I said before, but it can, happen to anyone who swims any stroke. And it's mostly due to the position of the knee during breaststroke kick. If you guys remember the clip I just showed you, the knees stay very close together while the ankles are going outwards, and that creates a lot of force on the inner side, on the inner part of your knee. So the rotation of the kick affects the medial collateral ligament, which runs along the inner side of the knee, which you guys can see in this picture that I have to the right. And if the painful exercise, like if the pain doesn't stop while you exercise, if you don't stop exercising because it hurts during exercise, it can lead to an MCL tear. So why do swimmers get this? Well, a swimmer, as I said before, a swimmer can have swimmer's knee no matter what stroke they swim, but it's most common in breaststrokers. And as I said before, you guys can see in this picture how the knees are closer together than the ankles. That puts a lot of force on the inner part of the knee and can easily irritate your knees. So treatment for this, there's medications to reduce the swelling and pain, rest from breaststroke kick, and stretches to improve flexibility. Obviously, these are not for swimmers who have MCL tears, but this is the general guidelines if you're having pain in that area. And the last common area for injuries I'm going to talk about is the lower back. And as I said before, I actually have a herniated disc in my lumbar spine, so this is very interesting to me, and I've actually gone through a lot of this pain and a lot of this treatment, so it's very interesting to me, and I like learning about it because I can apply it to myself. So what is it? I've included a picture of the lumbar spine here because my herniated disc is between is L4, L5, S1 area, which is labeled in this diagram here. So just wanted to show you where my personal injury has occurred. Lower back injuries are common in swimmers, but like I said before, having a herniated disc is not common, which is what I have, but lower back pain is common. And while swimmers experience pain in their upper back, like between their shoulder blades, the low back pain is more common. Continuous stress is placed on the lumbar spine, and that causes a lot of pain. So low back pain can be the sign of many things. Muscle spasms, which I had because my disc was herniated and I was still putting pressure on it, so my muscles around it were letting me know. Tight muscles, you can get that from pretty much any exercise. Overuse and disc problems, which I have. So why do swimmers get this? A common complaint of swimmers with lower back pain is that flip turns are very painful. And another area of swimming that's painful is the dolphin kick. So swimmers use dolphin kick off, like coming out of their flip turns and doing butterfly. And I understand you guys might not understand what I'm saying, so I have included two very short YouTube clips. The first is the flip turn with a dolphin kick. So as you guys can see, both the flip turn and the dolphin kick put a lot of stress on the lower back, and that's usually where swimmers will start to notice their back pain. I've also included a clip of butterfly to show you so that you can see, one, what butterfly is, and two, to see the amount of stress that butterfly can put on your back. And both of these are actually very true because right now I am swimming, but I'm not allowed to do flip turns and I'm not allowed to do butterfly because they are both too painful. So as you guys can see, butterfly and flip turns can be very painful and very stressful on your lower back. The treatment for lower back pain, I've pretty much gone through all of these. Medication, if you have like a disc problem or they might put you on something like a steroid or an anti-inflammatory to get that swelling to go down. If you're just having tightness or muscle spasms, they might give you muscle relaxers, until you take Advil, that kind of thing. Heat before exercise to warm up your muscles, that is if you are allowed to complete exercise during your injury. Ice after exercise or when it's inflamed, because ice is the protocol for when it's inflamed. You don't want to put heat on it, and because it will aggravate the part that's inflamed. Resting from flip turns and dolphin kick, like I said, since I'm having lower back problems, I'm not allowed to do flip turns or dolphin kick because with me, if I do flip turns or dolphin kick, I get a sharp pain that goes all the way down my leg, starting in my back, and that's not helping, and it would actually be hurting, preventing me from getting better faster, so refrain from those. Stretching, you have to be careful with this because your hamstring, like an area like your hamstrings, can get really tight when you're exercising, and they can pull on your back. But while you're stretching your hamstrings, you want to make sure that it doesn't hurt your back. And then physical therapy, if it's bad enough. Like myself, I go to physical therapy twice a week and treatment 6 times a week. So, and they have set exercises depending upon your injury, what you can do. And another topic that I've added in here is weights, talking about the technique when you're doing weights. Because for me, I had back pain. I'm a junior this year. I had back pain my freshman and sophomore years, but the very first weight sessions that we had back here this semester, I was doing front squat with weight, and that's when my back just gave out. So they think that my disc was irritated, and then that was the exercise that just herniated it. So along with other teams here at UK, the swim team lifts weights 3 times a week. So a lot of the lifts include heavy weights because you're trying to maximize, your strength. So if you're not careful and use good techniques, then you can easily injure yourself. Now, I was using good technique, and a lot of people who are using good techniques to injure themselves, you just have to know where your limits are. And if your back hurts, don't do something that hurts your back. And I've included an example, a YouTube video actually from the UK weight room of a power clean, which is one exercise that is an example of what you should not do if you have back problems, and you'll see why. But like with all of these exercises, you could hurt anything if you don't have good technique.
Go.
So that was an example of power clean, and as you guys can see, it can be stressful on many parts of your body, including your back. And actually, personally, I'm never allowed to do power cleans again because it's so stressful on your back. So, conclusion, I talked about impingement syndrome with your rotator cuff and tendonitis in your shoulder, swimmer's knee, which is usually for swimmers who specialize in breaststroke, but can be common in any type of swimmer, low back pain, everything that's associated with that. I talked about my personal injury and weights and how you have to be very careful using your weights and your technique and just knowing your own body. So here are a list of all the references and YouTube videos that I used. So I hope you guys enjoyed my presentation, and I really appreciate all of your feedback. Thanks.